Presenting a new series, Medically Verbal, where we'll solve case history in just a couple of minutes. Disclaimer: these case studies are for understanding purposes. Inaccuracies may be present. Do not attempt these processes without the guidance of a licensed medical professional. Case 13. Chief Complaint. A 65-year-old male presents to the emergency department with sudden onset severe headache and vomiting. History of present illness. The patient describes a severe headache that started suddenly about 1 hour ago. She rates the pain as 10 on 10 in intensity and states it is unlike any headache she has experienced before. She also reports associated nausea and 1 episode of vomiting. There is no history of trauma, recent infection, or changes in medication. Past medical history: hypertension, hyperlipidemia. She is currently on amlodipine for hypertension and atorvastatin for hyperlipidemia. Doesn't smoke, an occasional alcohol user, is a retired teacher. Mother had a history of stroke. Physical examination shows BP 180 systolic, 100 diastolic, highly hypertensive. Heart rate 82, respiratory rate 16, temperature 37. Her neurological findings show that she is alert and oriented with no focal neurological deficits. Her cardiovascular region shows regular rhythm and no murmurs. Respiratory region shows clear to auscultation bilaterally. Her abdomen is soft and non-tender. Initial differential diagnosis: primary headache disorder like migraine, hypertensive emergency, subarachnoid hemorrhage, acute glaucoma, intracranial mass lesion. Based on this presentation, what do you consider the most likely diagnosis and what further investigations or management steps would you recommend? If you're thinking hypertensive emergency, you are just right. A lot of people might think subarachnoid hemorrhage, but a key finding in that disease is the person should present with nuchal rigidity, and this patient does not have it. At the same time, her past medical history would strongly suggest that as a risk factor for her dealing with hypertensive emergency. If you're thinking subarachnoid hemorrhage, you might be wrong this time, because subarachnoid hemorrhage presents with nuchal rigidity and the person doesn't have it. If you are thinking hypertensive emergency, then you are right, because sudden onset severe headache does occur due to acute increase in the blood pressure. Vomiting also occurs whenever, because of the pressure increase, sometimes the vomiting center may get induced in the medulla, because of which the vomiting can get induced. We'll first of all control the blood pressure using antihypertensive medications intravenously so that we could prevent any organ damage. Provide her with analgesics needed. For diagnosis, we'll do a CT of her head so that we could rule out other causes of headache. Laboratory tests like electrolytes, renal functions, and cardiac biomarkers to assess for end organ damage. At the same time, we're concerned with a nephrologist. Hope you like the case study of today. You can come back whenever you want to sum it up. Please make sure that this is not a substitute of medical advice.
Other diseases that directly it's related to brain, but the neurological deficits were absent.
Corrections or suggestions, comment down below. Make sure to like, share, subscribe, and hit the bell icon to never miss another update.